type 2 diabetes is, first of all, insulin resistance. So we must treat the insulin resistance. How do we treat the insulin resistance? Let's lower the insulin levels. Let's get the patient as metabolically healthy as possible. Let's lower the triglycerides, increase the HDL, get rid of the blood pressure, get rid of the high sugars, and all of that has one same treatment. So that's quite easy. Just get rid of the carbohydrates and don't be hungry. Instead, eat healthy proteins and healthy fats.
So hello everyone, to you all low carbers out there. For those of you who are new to my platform, I am Dr. Don Agopra of the Low Carb Health Doctor platform. I'm a consultant neurologist and I'm advocating for the low carbohydrate diet, also known as therapeutic carbohydrate reduction or ketogenic metabolic therapy, which I'm particularly using for my stroke patients for the reversal of metabolic syndrome. In today's podcast session, we have a very special guest. She is an endocrinologist by profession, an endocrinologist being a doctor who is specializing in the very center of treating diabetes. She's among the rare find a few gems worldwide because she specializes in treating diabetes using therapeutic carbohydrate reduction. She's no other than Dr. Mariela Glandt. Dr. Glandt, a very great day to you. And welcome to the Low Carb Health Doctor podcast. It's indeed a great honor to have you with us today.
Thank you so much for having me. The honor is mine.
Okay, so may I call you Mariela?
Of course, please do. Please.
Okay, so for everyone listening in, for myself, we would appreciate a lot if we all get to know more of you, Mariela. Could you give us a brief background of yourself and your current professional work, as well as your past and present affiliations?
Sure, I'd be glad to. So I'm an endocrinologist, as you mentioned. I'm originally from Argentina, but moved to the U.S. when I was 10. I was, I was fortunate to study at very great places. I was at the University of Pennsylvania, then at the University of Texas in Houston. Then I did my residency at Harvard at Beth Israel, and then my fellowship at Columbia. And then started a whirlwind of different traveling around the world, I guess. No, not really. I worked in the U.S. and then moved to Israel, where I was a little bit of an outsider in Israel, and because of that, I was able to start my own practice in a way that allowed me to practice exactly as I felt was fit, and was not really under the influence of any major organization. And this was a stroke of good luck, because I was able to it happened that I discovered the ketogenic diet about 10 years ago, and about 8 years ago started implementing it in my clinic. And it was I was very free to do what I felt was right for the patient. So it was even though I was kind of by myself, it was also good luck that I was by myself, so that I was able to really implement this new change without anybody telling me this is, you can't do this, which is normally what happens to endocrinologists who would like to implement a ketogenic diet but work under the guidelines of institutions.
I moved to Israel when I married my husband, who's Israeli, and there I basically had a few different experiences until I landed in my own clinic 9 years ago. And at that point, it happened to coincide with me basically coming to, the realization that I wasn't treating diabetes the way that made the most sense. I went through the aha moment that I think all of us in this field at some point go through, where you just kind of realize that, wait a second, something here doesn't make sense. And there's a better way of doing this. And there's more science behind doing this the low carbohydrate way, especially in something like diabetes, where it's the low hanging fruit, where it's very, very obvious that diabetes is an intolerance to carbohydrates by definition. And so it makes a lot of sense to practice the ketogenic, to offer the ketogenic diet to patients. So at that point, I started really implementing this in all my patients. And since then, it's been a really, really amazing whirlwind of practicing medicine the way that really gives me results and satisfaction. So I think it's that would kind of sum up the last few years.
Yeah, I particularly value the word satisfaction. I also experienced it myself ever since I advocated for therapeutic carbohydrate reduction among my patients. I indeed had a lot of satisfaction myself. And I'm curious, what inspired you to become an endocrinologist? And corollary to that, how did you eventually arrive in the low carbohydrate space, especially using that patients?
Well, what inspired me to be an endocrinologist, I think, is kind of a no-brainer. My dad has type 1 diabetes. I guess I just always paid more attention to this. It was always very close to my heart, and I wanted to, it just seemed like a natural progression when I was in internal medicine to follow up with endocrinology. Plus, I love the study of the body as a whole. I always liked to study how all the parts work together. And also, I'm just terrible in the operating room. It was not my field at all. So I knew what I didn't want to be. But anyway, it surprised nobody when I became an endocrinologist. How I ended up as an endocrinologist who practices low carb, it was a series of events, and it wasn't an obvious thing. It was slow. It took some time till, to get to that point where the as they say in Hebrew, the asimon fell, meaning like the coin fell, like it took some time for me to get it. It took some time because I really it made intuitive sense that we should be low carb, but then there's a whole other step to really understanding the low carb movement, which is also accepting that fats are good for you, that real natural fats are actually good for you. So this is like the second step. First, you're like, oh yeah, you should eliminate sugars, of course. But then, understanding that there's so many layers that don't make sense in what we're preaching to patients is a whole other ballgame. And this, I have to thank my dear friend, Jessica Apple. The conversations with her and her brother, Sam Apple, over the years really helped me to understand this. So I really, there are other people, but getting to that famous video by Dr. Sarah Hallberg that said that reversing diabetes by ignoring the guidelines, it really, I was like, wow, there's really something here. And that led to a whole journey. I'll never forget that day, because then I just kept reading and reading and reading and reading, and I was like up for hours and driving my husband crazy. Is crazy, saying, wow, this is like something is shaking my world. It was a real aha moment for me, like all at once. So, and since then, that's it.
And as I was saying earlier, you are a gem of find. There's only a handful of endocrinologists out there who really advocate for, let's say, reversal or remission of diabetes in such a manner by restricting carbohydrates. So I'm sure you have a lot of challenges of your own in advocating for that. So I'm curious, yes, what are some of these common challenges that you're currently facing in your practice as an endocrinologist, specifically advocated for the ketogenic lifestyle with therapeutic carbohydrate reduction?
Well, I think we all run into the same challenges, I believe. It's the first thing is that, well, there's just so many, I don't even know where to start. There's just so much resistance from the surrounding, from the medical community, as well as the guidelines. So you're really going up against a lot. And to make things more complicated, we're also going against the vegan movement, because and the fear of the environment, and you know, so there are many layers of the things that are against us. But I think let's start with the medical institution. As you know, as long as the guidelines are advocating that we use, you know, what I actually want to say is that the guidelines have changed and they are more open. It's just that people are not aware of it. And therefore, the challenge hasn't changed. Fortunately, actually, there is an opening, and the American Diabetes Association is more open to this, which does actually help. But when I look at my trajectory, the challenge hasn't really gone away. Okay, we have a medical establishment that's very much afraid of the ketogenic diet, starting with the name. The word ketosis, you know, evokes some fear in doctors because of the confusion between ketosis and ketoacidosis. And of course, we know that there's a very big difference. Ketosis is a state where we want to be in, as ketosis is a wanted state where the body is burning fat for fuel instead of sugar, and this creates ketones, and ketones are molecules that give us energy but are also anti-inflammatory and are signaling molecules that have a ton of benefits for the brain and for the body as a whole. But doctors are afraid of ketoacidosis, which is what happens when you have uncontrolled production of ketones, and this uncontrolled production causes, because ketones are acidic, they actually can change the pH of the blood and lead to a very an emergency situation. This is something that we would only see in type 1 diabetes or in very rare cases of type 2 diabetes when we use this in conjunction with SGLT2 medications. So these are the only two cases where you would see diabetic ketoacidosis. Yet doctors are very afraid of the word keto because of this reason. That's one of the reasons. And the other thing is the association with saturated fat. When people think about eating a ketogenic diet, they think of a lot of saturated fat, and this immediately evokes the idea of clogging arteries. You know, eating saturated fat, the diet heart hypothesis, which we know has never been proven, which says that eating saturated fat will increase our cholesterol, will lead to clogging our arteries and therefore heart attacks. And these two things are really what lead to doctors to run away from the ketogenic diet. So it takes a lot of diving in, a lot of reading and understanding why this is not true. And that's not something that any doctor will ever learn in any medical conference. That's the key here.
You're spot on there, because in my case, I learned all this through self-learning.
That's not.
Yeah,
Exactly.
what you were saying earlier about the ketosis, the diabetic ketoacidosis versus nutritional ketosis, which is, you know, there's a lot of misconceptions out there about ketosis, and they confuse nutritional ketosis with diabetic ketoacidosis, as you said earlier. So, aside from what you've shared earlier, can you provide us some other professional insights you may have about low carbohydrate ketogenic diet, especially in relation to its potential mechanisms, perhaps risks or benefits and potential risks that especially you in your practice as an endocrinologist in relation to your patients currently?
I mean, I would say that it just works every time. You know, anytime that the patients actually follow the advice, they get better. Okay, I have never seen a patient who follows the advice and doesn't get better, because as we said, by definition, diabetes is carbohydrate intolerance. When you take the offending agent out of the picture, the patient gets better. So that's all there's to it. You know, this goes for type 1 and type 2, but now I'll focus on type 2. But, you know, in type 1 diabetes, we can't really get rid of the requirement for insulin, nor do we want to. We need insulin. You know, insulin is not a villain. We do need insulin at minimum amounts, and we know that we want low amounts of insulin in our blood. So that's a different story. But that's a story for everybody. But in type 2 diabetes, it's very clear that we don't have to have diabetes. And to me, this is absolutely fascinating because nobody needs to be sick. All we need to do is take the offending agent out. And when that happens, the sugars drop. I have patients that start out with A1Cs of 15 who are actually doing fantastic now by just removing all the carbohydrates. And sometimes this needs to be tweaked. This morning, actually, I have a patient who has been struggling, and finally, once the dairy products came out, her sugars normalized. But with the dairy, they were still in the 300s, or high 200s. And when she took out the dairy, boom, it fell into the low 100s. So that's so, exciting because it's a process of tweaking, but, it doesn't take that long to figure it out. It's just a matter of playing with the different types of foods within what we call a ketogenic diet. But in general, my message is that anybody who has diabetes can benefit from this diet. And what I mean is, maybe we won't be able to get off all the medications. My goal is for the patient to be healthy. If it requires medications, that's fine. But let's use the right medications that lower insulin resistance. Let's try to get rid of the insulin as fast as possible so that we can actually resensitize the body to responding to insulin. So, it's type 2 diabetes is insulin resistance first. And then only later, one of the manifestations of insulin resistance is type 2 diabetes. But as you know, and other manifestations are stroke, cardiovascular disease, etc. So type 2 diabetes is probably the most common manifestation of the big diseases of insulin resistance. But type 2 diabetes is, first of all, insulin resistance. So we must treat the insulin resistance. How do we treat the insulin resistance? Let's lower the insulin levels. How do I lower the insulin levels? First of all, I get, lower the insulin as fast as possible. But second of all, I eat foods that don't increase my insulin, which are carbohydrates. And so with the combination of these two things lead to a very quick reversal. So to me, the goal is let's get the patient as metabolically healthy as possible. Let's lower the triglycerides, increase the HDL, get rid of the blood pressure, get rid of the high sugars, and all of that has one same treatment. So that's quite easy. Just get rid of the carbohydrates and don't be hungry. Instead, eat healthy proteins and healthy fats, or proteins and healthy fats, and then you will be satisfied. And it really works. The big problem is that we are addicted to carbohydrates. That's the real issue here. We're addicted to carbohydrates, and that's what makes it difficult. But if you have support and you have knowledge, education, and the will to do this, then there really is a way.
I am particularly amazed at your passion for insulin in relation to type 1 versus type 2 diabetes, because as you said, and I was listening to your Low-Carb Denver lecture a couple of days ago, wherein you were stating that in type 2 diabetes, since the problem is insulin resistance, then technically the more you give insulin to the patient, the more potentially insulin resistant that patient becomes, since you are not really treating the root cause. And I think I also heard this from Ben Bickman. He was comparing insulin to, it's like he was comparing giving insulin, administering insulin to a type 2 diabetic to an alcoholic, wherein if you want to treat an alcoholic and you give him more alcohol, ethanol, it's not really solving the problem, it's making the problem worse. Do you agree with that?
Oh yeah, I love that analogy. I think he's right on. He's a brilliant guy, and I think what we see is that we're making ourselves feel good by lowering the sugar, but you're just trying to force the body to take more and more of this substance that it's rejecting, right? The message is very clear. The sugar stays in the blood because the cells are not interested in having more energy. They are stuffed with energy. And since insulin doesn't just bring in sugar, but it also stores fat, this is the one other function of insulin, then the fat cells are overstuffed and they don't want to respond to insulin anymore. They have stored enough energy. So basically the body is saying, we have enough for this particular body.
In your practice and as an endocrinologist, I'm sure you've gone through a lot of patients already since you've been running the Glandt Diabetes Center for so many years already. For how long has it been there in Tel Aviv already? 6 years?
Yeah, it's 9 years already. 9 years that we started the diabetes center.
Yes, so you should have a lot of experience already. Can you share with us some of the success stories of your patients there? And also in that startup that you started, I think that's Ona Health, right? Or in your clinics.
Yes,
there.
Ona Health.
Yeah. Well, do you have any particular success stories among your patients that are very inspiring to share, probably to everyone?
Well, yeah, I will say that we have actually just published an article, and I can share it with you, showing some of our data. We treated over 3,000 patients with the diet, and what we did is we pared it down. It's a clinic where it's not like a primary care office, so people don't come all the time. So getting data to be very consistent at times 0 and 6 months is what actually led us to have to pare it down to 344 patients who were diabetic, and we excluded all the ones that came for other reasons like obesity, etc. So we really, for example, in the patients that were taking insulin, you see that 79% were able to stop insulin altogether, and the others who were still remaining on insulin were able to, sorry?
79%, that's amazing.
Yes. Yes, right? So that's not obvious, right? Normally when patients are placed on insulin, we think that they're going to be on insulin for the rest of their lives, but no, okay? There's no reason to stay on insulin, and that's our one of the things that you see in our clinic is that 79% of the patients were able to stop taking insulin. So this is something that brought a lot of inspiration to the people around me. And since I wasn't, being in Israel is a land of a lot of startups, a very complex place. But besides that, I won't get into that right now. What we did is we got together and decided that it was time to bring this to more people, and Ona Health was born. And with Ona, we're actually treating people, Ona coming from the name of owning your health, taking responsibility for your health. And we have now started working in the United States. And one of our pilots is in the Bronx. And I am having the time of my life working there because this is a place that is very underprivileged, has a lot of difficulties on so many different levels. People are struggling on many fronts at the same time, and you would not expect that they would have such amazing results. But I am thrilled with the compliance that I'm seeing in this patient population. I'm thrilled with the dedication and the enthusiasm that they have for learning how to get out of this problem. People who've had horrible diabetes for years, who couldn't leave their couch from pains that they were having, are suddenly throwing parties, are suddenly, becoming the biggest advocates of a ketogenic diet because they've seen the change in themselves. So one of the barriers people always think is money. Well, actually, no. Okay, there are ways of doing this on a low budget. And I think that's really encouraging for me to see that, because this is a diet that anybody can do. Anybody who is ready to change their condition and who is able to receive the right education. So this is what we're doing. This is Ona Health in the Bronx. Yes, this, you know, as far as a particular example, I mean, I have many. I have this a patient who was an ex-heroin addict, who was tired of being diabetic, and developed, he has all sorts of pains and neuropathies, etc., and is now perfect sugars, lost 22 kilos. So I don't know how many pounds that is, but he's lost quite a bit of weight. And, you know, just doing fantastic. And this is, it didn't take a long time to get there. I mean, there's just so many, there's cases after cases. And we're also, sometimes you see also improvements in mental health that are so exciting, that are, you know, coming along with the improvements in blood pressure, sugar, and weight. So it's the whole package. It's the whole package. Everything improves, or a lot of things improve. So, you know, it's not a miracle cure, but if you've had a motor vehicle accident, we might make a difference actually, but, you know, we may not be able to get rid of the whole thing. But so much of it depends on giving patients the opportunity to do it and not being patronizing about it, and not deciding for them if they can do it or not. Let's offer them the opportunity to do it, first of all.
As I always tell my patients also, diabetes is right there at the center. It's like at ground zero metabolic syndrome, because metabolic syndrome, the mechanism is insulin resistance, and the worse it gets, then that diagnosis of type 2 diabetes sets in. So I also mentioned it before that among the top 10 causes of deaths worldwide, as published by the World Health Organization, among the top 10, that includes the non-communicable diseases, and number 1 would be ischemic heart disease, number 2 would be stroke. So it's just sometimes it's stroke, and other years it's malignancy or cancer. And then there are also reports that, of course, cancer and certain cancers are also heavily influenced by intake of carbohydrates, especially refined carbohydrates like sugar, because of the Warburg effect. So I'm sure in your own set of patients, which is within the spectrum of metabolic syndrome, a lot of them would also have less complications like stroke and heart disease.
Right. Isn't it amazing that they write it like that, right? Because really the number one thing should be insulin resistance, because all of these things fall under the same umbrella, right? Or most of them, right? So, if we actually understood that most people with heart attacks actually have insulin resistance, then it wouldn't be seen as, you know, we wouldn't separate between diabetes and stroke, right? Or diabetes and heart disease in the list. Correct.
So what practical tips and advice can you give to the general audience who may not have yet encountered reducing carbohydrates as a main way of addressing diabetes? And corollary to that, would you have any message to our fellow physicians worldwide, especially those who are not that familiar, perhaps not even aware of what the low carbohydrate nutrition therapy or therapeutic carbohydrate restriction is all about?
I would say, let's see. First of all, as far as tips, the first thing I would do is stay away from junk food. Okay, store-bought food is quite problematic because it combines the carbohydrates, the refined carbohydrates, with sugar, particularly fructose, and the seed oils. And this combination is really addictive and damaging to our cells. So the first thing I would do is start cooking at home, and very quickly, once you actually start, you will realize that you're not hungry and that you can do this. I think it's very daunting at the beginning, because when people have high insulin, it's asking to eat more and more. It is particularly carbohydrates. So when you first say, let's take away the carbohydrates, it feels like you're taking away, you know, heroin from a heroin addict, because we are so addicted to carbohydrates. So once we are into it, it gets much easier, and this change happens quickly. So it's really worth it to try. So that would be my first advice to patients, or to anybody who wants to try this. First of all, get rid of the junk food, but second of all, very quickly, you're going to see how great you feel and how you start to have control over your life once again. As far as my fellow doctors, I would say, you know, it's hard to believe that we've learned the wrong thing, and this is like a little bit heartbreaking. You know, and I'm not usually like a conspiracy theory kind of person, so that's why being in this position is kind of interesting for me, because I really believe that I believe my mentors, and I believe it, and I don't think it's coming from a bad place. It's just that history has taken us through a very long-winded journey that has led us to ignore the science, and that is really leading us to not treat patients in the best way. So I would say, yes, it's very, very scary to step away from what we've learned, but it's actually necessary in order to do the best thing for your patient and to do the most scientific thing for your patient. This is not alternative medicine. This is not, you know, fringe. This is the real thing. This is, you know, where the science is actually the strongest. So I think that what's very, very scary for most of us is to realize that we have been doing the wrong thing. I certainly was, you know, in shock to understand that I had been giving people so much insulin for so many years, and that this is the wrong thing to do. So, you know, it took me, I was in quite a bit of shock. And I encourage everybody to go through this process to understand that there is a better way of treating our patients, and they will be healthier and happier. So it is scary, but it's definitely worth it. So that's what I would tell them. Dive in, read, get into it. Don't be afraid.
It's a great message you have for our fellow physicians worldwide, Mariela. And for those who may be interested to follow you, do you have any, where can they find you in social media or your platform? Can you share them with us?
Yeah, I'm not a very big social media person. Unfortunately, I should have done that years ago, but I haven't. You can take a look at, first of all, you can look at ona.health. This is, you know, patients can sign up there and get more information, ona.health. Also, you can look up glandt.co.il. This is our website for the clinic. And I guess you can find some of my lectures on LinkedIn and Facebook. So yes, and I will get on Twitter eventually.
So you're not yet on Twitter?
I am very, you know, I should have done this a long time ago.
Okay, so
It's very time consuming.
Aside from Tel Aviv, Israel, do you often go to New York still?
Yes, I'm in New York once a month. I'm in New York right now, so I'm traveling quite a bit.
And Spain as well?
Yes, it's getting very confusing. It's hard to keep track of me, but really, I'm very focused right now on the United States.
So anyway, we'll be talking probably some other time soon to clarify that. So I think that's essentially what the more important things we need to be talking in this session, Mariela. And thank you very much for gracing this episode of the Low-Carb Health Doctor podcast.
Well, thank you.
And thank you very much for your valuable time. And that journal article you mentioned earlier about the experience of your patient, I think I came across that a couple of days back or yesterday. I'll post a link to that in the show notes below, so that
Perfect.
so can also refer to that, and also our fellow physicians can look at that, because I think it's a great. I think you wrote that with David Unwin, right? If I remember.
Yes.
Correctly. Yeah.
Yes, I brought David Unwin on board because he's done this in his own practice, so I thought it would be good to get his input. Yes.
Yeah. So it's
he was very helpful.
It's a great experience. I think it's also somehow related to what David did before in England. Yeah, so he had a great experience.
Yes.
I think you are essentially duplicating his experience, more or less, essentially the same amazing way.
He is a primary care doctor, so he sees the diabetics right away. He has a lot of it's a little bit different. We are an endocrinology clinic, and one of the difference between his publications and ours is that he sees patients that have less duration of diabetes. Ours are sicker patients with an average of 12 years of diabetes. So it's slightly different cohorts of people, but I think both are valuable.
Okay, so
valuable to look at real practice, the implementation of ketogenic diet in the real world.
So we hope to see more of those. And here in the Philippines, we still have limited experience in terms of writing those experiences in the journal, and hopefully we will also follow your example someday and probably do it also with David.
Great, let's do it.
With your inputs. Okay. So again, thank you very much, Mariela, for your valuable time, for sharing your insights in today's episode.
I think it's amazing that you're bringing this to the Philippines. This is amazing. Really, congratulations.
Yeah. And I hope to see you again in the Low-Carb Health Doctor platform in the coming days.
Thank you.
And